Good afternoon and welcome to today's Downing Street press conference. I'm pleased to be joined by Chief Medical Officer Professor Chris Whitty and also our Chief of Defence Staff Sir Nicholas Carter. Before CDS talks through the fantastic work that our brilliant armed forces have been doing during this crisis, let me give you an update on the latest data from the Cobra coronavirus data file. And I can report that through the government's ongoing monitoring and testing programme as of today, 559,935 people have now been tested for the virus, 133,495 have tested positive, and of those who have contracted the virus, 18,100 have very sadly died, and we express our deepest condolences to the families and friends of these victims, and my heart goes out to every single one of those who have lost a loved one throughout this crisis. As a government, we continue to take the steps necessary to slow the spread of this virus. The social distancing measures that people have overwhelmingly adhered to have meant that fewer people have needed hospital treatment. That has protected our NHS capacity as we continue through the peak of this virus, and it has undoubtedly helped to save lives. At every point in this crisis, we've considered the scientific and the medical evidence that we've received very carefully, and we've been deliberate in our actions so that we take the right steps at the right time. Now, I know it's been tough going for businesses, for families, for vulnerable members of our communities up and down the country. And it's been a physical strain as we adapt to living and working at home while not seeing our family and our friends in the usual way we would like to. It's been an economic strain as businesses have had to furlough staff, which is why the Chancellor launched the various business support measures to help see businesses and workers through these difficult times. But it's also been an immense mental strain on everyone. People stuck at home, families worried about their finances, and the elderly more isolated than we'd ever want them to be. We are making progress through the peak of this virus, but we're not out of the woods yet, as SAGE advised last week. And that's why the measures we introduced must remain in place for the time being. The greatest risk for us now, if we eased up on our social distancing rules too soon, is that we would risk a second spike in the virus with all the threats to life that would bring, and then the risk of a second lockdown, which would prolong the economic pain that we're all going through. And that was a point that Andrew Bailey, the Governor of the Bank of England, also made earlier on today. So with that in mind, last Thursday I set out the 5 principles that will guide our approach going forward to the next phase, and which must be satisfied before we are willing and in a position to make any changes, which will of course be based on the advice that we receive from SAGE. That way we will ensure that our path out of this crisis is sure-footed, protecting both the public's health but also our economy. If we stick to our plan, if we take the right steps at the right time, we can get through this crisis, and I know we will. There's no hiding the scale of this tragedy. But even in our darkest moments, the crisis has also shone a light on the best amongst us. And the nation has come together to applaud our heroic NHS staff, our carers, every week, and we pay tribute to their dedication, their professionalism, and the care with which they look after those who have fallen sick. And with General Carter here today, I think it's only fitting to pay tribute to the amazing work of our fantastic armed forces and their whole MOD, led by Defence Secretary Ben Wallace. They have been there every step of the way, helping us to build the new NHS Nightingale hospitals to reinforce our critical care capacity, supporting our local resilience forums in delivering personal protective equipment where it's needed most, and helping also to deliver the mobile labs which are critical to ramping up our testing capacity right across the country. And as a result of those efforts and that teamwork, hospitals have been able to treat more patients. As a result, they've saved more lives, and we've ensured that the peak of this virus has not overwhelmed the NHS. And today our armed forces are again part of that team as we announce 2 new deployments to the NHS Nightingale facilities in Harrogate and Bristol. And across the UK, this extra hospital capacity, which itself comes on top of the 33,000 additional beds we've managed to free up across the NHS, that's the equivalent of building an extra 50 district general hospitals. And as I said, that has safeguarded the capacity in our hospitals, both to care for coronavirus patients, but also to make sure other people get the urgent care or the emergency treatment they need. People used to joke in this country that you could never build a hospital that quickly. Well, we didn't just build one, we built 7, and we thank our armed forces for helping to make that happen. And you know, for many countries around the world, including modern democracies, the sight of their military on the streets in a national emergency could be a cause for concern or even trepidation. But for the British people, the sight of our armed forces working side by side with our brilliant NHS staff offers a calm reassurance that the task is at hand and that we will come through this crisis. Now, I make no bones about it. There have been challenges, there still are challenges. We're not there yet. We continue to ramp up the testing capacity, which will play a really important role in the next phase of the crisis. Amidst a global shortage in personal protective equipment, we've distributed over 1 billion items to the front line where it's needed most. We've just brought in Lord Dayton, who helped organise the London Olympics to boost our domestic supply even further. And I'm on the phone every day pursuing the next batch of deliveries from abroad with the support of our tireless diplomatic service. And the first of several new deliveries landed from Turkey in the early hours this morning. We will only come through this global pandemic if we come together as a nation and if we bring other countries around the world together so that we can rise to this international challenge. And as we work with our partners abroad to get the PPE we need, to get the ventilators we need to pursue a vaccine for this terrible virus, we're also working night and day to return stranded British nationals from all 4 corners of the world. We've kept airports open and airlines running to bring over 1 million Brits home on commercial flights, a massive endeavour. And on top of that, at the FCO, we set up a £75 million special charter arrangement with the airlines, and that's already brought home over 13,000 people on 63 flights from more than a dozen countries. And we're organising more charter flights in the days ahead from India, Pakistan, Bangladesh, New Zealand, Nigeria and Sierra Leone. So at home and abroad, we're meeting the whole range of challenges that coronavirus presents. And if we stick together, and if we stay the course, we will defeat this virus for good. And I think I'll now turn over to Sir Nick to brief us on the latest military involvement in the effort.
First Secretary, thank you very much. The First Secretary has asked me today to give you an update on what the Armed Forces and Defence as a whole is doing in support of the government's response to the virus. Up front, I would say that our role has been entirely in support of the heroic healthcare workers on the front line. That's both the NHS and social care, with humility very much being our watchword in the way that we give that support. We've done it in a variety of ways. We've supported first and foremost the Ministry of Housing, Community and Local Government and the devolved administrations through the national spine of local regional fora that the First Secretary referred to. And we've had dozens of liaison officers embedded into each of those fora. It's a tried and tested system that's been used many times in the past, whether for delivering military aid to the civil authorities for the foot and mouth or for flooding or for wildfires. It's frequently exercised, and there are very close relationships which give great confidence between all of those who are working on those teams at the lower level. And I think it's important, this, because of course it's that delegated sense at that level which works, because it makes them much more responsive and much more flexible to local demand, whether it's for ambulance drivers or for testing or for whatever else, with decentralisation being so much of the key to the way some of this is done. And the Defence Secretary delegated authorities to this level early in the crisis, which has proved to be extraordinarily successful. We've also been giving support to the Department for Health and Social Care and, of course, the NHS. First and foremost, this has been a logistic task. And I would say that I think in all of my more than 40 years of service, this is the single greatest logistic challenge that I've come across. I'll just give you a scale of the problem. In 25 days since we started working together with the NHS, they've gone from some 240 customers they deliver to normally to nearly 50,000 customers. This has involved creating 260,000 square feet of distribution warehousing. That's nearly 4 football fields worth. And some 38 additional delivery routes per day. That's the equivalent to driving 3 times round the world. That is a major logistic challenge. We've, of course, been involved in the Nightingales, which the First Secretary referred to, but we've also been involved in planning and what we call command and control, providing additional resilience to hard-pressed staff. And we've got dozens of people embedded both in Skipton House, but also in Victoria House, where the DHSC headquarters is. We're involved in testing, both in terms of playing a role in helping design the system, but also in manning some of the regional test centres, and adopting some innovative approaches, like mobile pop-up centres, which will make it possible to get to the decentralised areas that I described earlier. And a brigade commander we have there, Brigadier Lizzie Faithful Davis, and her team have been very imaginative in the way that they've taken this forward. And of course, we've provided an aviation task force that's been able to support the communities from Scotland down to the Channel Islands, in Northern Ireland, and from Wales to the east coast of England. We've been involved in helping the Foreign Office with repatriations and supporting our overseas territories, where we have security advisory teams deployed now in several of them. And of course, we've deployed ships, HMS Argus, to do just that. And we've been involved with the Cabinet Office Rapid Response Unit, with our 77 Brigade, helping to quash rumours from misinformation, but also to counter disinformation. Between 3,000 and 4,000 of our people have been involved, with around 20,000 available the whole time at high readiness. We probably have at the moment some 73 ongoing tasks, and we've probably completed about 30. What's interesting is it's been very much a whole force, not just of regular military from all the three services, but reservists as well. Some 15% of the force has been reservists. It's involved defence civilians, defence contractors, scientists from Porton Down, and something called the Engineer and Logistics Staff Corps, where we bring in people from industry who work inside the military in times of crisis and provide expert support for how we might link into the civilian community to bring forward skills and indeed industrial support. The skills have been about planning, logisticians, medics, engineers, and CIS or IT-based people. And the role has been very much about catalysing, designing, and supporting. And I'll just single out one individual to give you an example of the sort of backgrounds that we're talking about. A young major called Major Eb Mukhtar has been mobilised from the reserve. He's really stepped up to the plate. His daytime job is as a logistics expert who runs Google's transport network across Europe, North Africa, and the Middle East. He's been part of the supply team that's been working on how we distribute PPE. He's designed an e-portal in partnership with eBay, which will in due course manage individual customers. And he designed a bulk supply chain for distribution of PPE to all of the NHS regions and trusts. Now, despite all of this, we are still involved, of course, in protecting the country, and there are essential operations that must continue, whether that's defending the homeland with the nuclear deterrent or protecting British and UK airspace more generally, whether it's overseas operations in Afghanistan, the Middle East, Africa, and further afield, or whether it's about fielding essential operational capability. And what we do as we do this is to take great care not to endanger the population. All of this is a truly national endeavour. We've even mobilised 99-year-old veterans. And I think everyone would agree that Captain Tom Moore embodies the sense of service and duty ingrained in our armed forces. Our armed forces are drawn from every part of the United Kingdom and much of the Commonwealth. And they take great pride in serving the communities that they are part of. Everyone is experiencing real challenges at the moment, and it makes me feel immensely proud of our collective national effort in pulling together behind those on the front line to combat this unprecedented challenge, which I firmly believe we will defeat together. Thank you.
Brilliant. Thank you very much, Nick. Chris, would you talk us through some of the latest data, please?
Thank you much, First Secretary. And before I do, can I just, on behalf of my colleagues in the NHS, thank the Armed Forces enormously for the assistance they've given us, which has been absolutely terrific. These slides are, I think, familiar to most people who watch this. The first is a look at transport usage in the country, and it's really as a proxy for our people continuing to stay at home except for essential business. And as you can see, although there is some bumping along, it has broadly remained very stable, despite the fact that people have had to do this for a considerable now period of time, and there is further time we're going to have to do this if we wish to pull the peak of this right down. Next slide, please. Looking at new cases in the UK, these are test positive, whether they're in hospital or out of hospital. As you can see, this is broadly flat with a slight trend downwards over the last several days, really back to about the 8th of April, but not a steep descent at this point. Next slide, please. And if you look at people in hospital with COVID-19, looking across the country, the situation is either improving, and I think it's pretty clearly improving, for example, in London, or broadly flat across all 4 nations. Next slide, please. If you look at people who have sadly died in hospital, this is not all deaths, but this is probably the majority of those who've sadly died with COVID. What you can see again is that the very steep upward climb that there was up to the earlier part of this month has now flattened off over the last week and a half. Next slide, please. And this is a slide we use just really to track the trajectory between different countries. I should be clear that trying to compare different countries using these kind of data is notoriously difficult, but it does show the trajectories between the different countries, with the UK using hospital data, which is our most steady source of data over that time. Next slide, please. This is just one slide we thought we would add in addition, because I think it makes a point which I think is important for people fully to understand. And what you can see here, this is the 7-day rolling average for deaths, sadly, in several countries, including the UK. And the reason I thought it was sensible to put this in was for people to see that even in those countries which started their epidemic curve earlier than the UK and which are still ahead, the downward slope from the point where we change is a relatively slow one. And we should anticipate the same situation in the UK. We should not expect this to be a sudden fall away of cases. Thank you very much.
Thank you very much, Chris.